Welcome to another edition of Caribbean Medical TV, the television series that journeys through our diverse and illustrious isles to explore all things health and wellness. The insights are bountiful, the lessons foundational, and parents, today we explore children's health. This is the pediatric episode.
Hello Caribbean, I'm Dr. Mishka Duncan Adams from St. Vincent and the Grenadines, and you're looking at Caribbean Medical.
I am Dr. Kevon Dindial, a pediatric oncologist and hematologist in Trinidad and Tobago. Parents, be sure to tune in to today's vital episode.
I am Dr. Taisha Donald, and I'm looking at Caribbean Medical. I encourage you to do the same.
Children, our most precious wonder and a symbol of promise, our future, our Caribbean, our coming world. In today's episode of Caribbean Medical TV, we look at the field of pediatrics and unlock its crucial role within our family and the greater community. From the moment a child is born to the time they enter adulthood, parents are tasked with nourishing the person they will eventually become. This is where the journey begins. Let's meet some of the healthcare professionals in today's episode.
The pediatrician's main role is to care for the health of children, and that caring starts from birth all the way up to the young adult stage. Now, caring for children includes prevention, it includes screening, it includes diagnosing, and of course coming up with treatment plans. And we also do a little bit of, counseling. We see you as a newborn, we see you as you grow, so we monitor the growth and development of a child all the way up to, in most countries, it's 18. And at that stage, sometimes we decide, okay, let us pass you on to an adult doctor. However, of course, because we're such an integral part of a family, sometimes patients would want to stay with us up to as far as 21.
Pediatrics is a very unique field, and you're not only treating a child, but you're also treating the entire family. In my field of pediatrics, and particularly pediatric oncology, I have to assume not only the medical role, but also approach the family in a holistic manner, addressing the psychological needs of the child, the parents, siblings, addressing the emotional aspects and financial aspects is key. And this is why the field of pediatrics is very unique. And it is very rewarding when you can address all these aspects and ensure the best outcome for the children and family.
A pediatrician is vital in helping parents navigate many aspects of early childcare. Even the first few seconds of a child's life can make a major difference to their future development.
When it comes to child development, it's very important to be aware of how your child is developing. Since before birth, children, especially the neurological system, develops at a very rapid pace. And anything that happens during pregnancy can put a person at risk of having a neurological disorder. So even before considering to have a child, taking your folic acid, making sure that you're healthy, whether in body or in mind, is very important for the neurological development of a child. There are conditions that can emerge, long-term consequences that can emerge as a result of issues that happen around the time of birth or directly after the child is born as well.
So we have to be very aware within those first days of life. Depending on that, we may keep the baby a little longer in hospital. For example, something as simple as monitoring for signs of infection. And along the way, you explain every single detail to the mommy. Some premature babies that we see, we follow up and we see how they're developing. You will not believe that this baby was just a little human being in an incubator. This is an example of an incubator here, and this controls the warmth of the baby, right? So the whole environment here is controlled. Sometimes within these incubators, we have to pass the lines for like oxygen, for ventilation, and so on. But basically it creates a control space and a safe space for the baby. And there are some babies that develop jaundice for whatever reason. It could be because of an infection, it could be because of incompatibility with the mother's blood group, the baby's blood group, all of these. In management of that, we have an example of one of the things we use for management. This is called the Billy light. Basically, it's a blue light that helps to break down the bilirubin. That's the substance that causes the yellowness of the skin.
Parents have an all-encompassing duty and focus during this fundamental stage. A major aspect of note is nutrition, which is key from day one.
In terms of breastfeeding, now breast is best, all right? And breast is a preventative strategy as well, because persons who breastfeed their children generally go on to be healthy. According to some of the studies, they even have a higher IQ. Breast milk has a lot of antibodies, especially that first bit of breast milk that you get, the colostrum. The colostrum is rich in antibodies, rich in elements that will help protect you against different illnesses. So what we've seen over the years with the different studies and so is that persons who breastfeed are less likely to develop all these food allergies and even chronic illness as they grow older. So persons who have a predisposition to develop some sort of allergy because their mother, let's say, may be asthmatic, a father who may have eczema, any one of these allergic conditions, it is advisable that you should really breastfeed because your chances of developing food allergies is high. The longer you breastfeed, less likely you develop food allergies, because what it does is strengthens your immune system, so you're now much better able to fight against all these allergens and even against all the chronic diseases that can come about as a result of introduction of other, well, what we call breast milk substitutes early on.
Thank you, Dr. Donald, for your insights. It was a pleasure chatting with you in the beautiful Spice Island of Grenada. You're watching Caribbean Medical TV. Be sure to subscribe to our YouTube channel for early access to our episodes. Stay with us and we'll be right back.
I can see clearly now the rain is
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
Welcome back to the program. Today we focus on the diverse field of pediatrics. Every stage is a new learning experience with all that exists medically, and even still there are common childhood illnesses one needs to be on the lookout for, as Dr. Donald advises.
As a pediatrician, it's a very important role for us because we want to help to prevent childhood illnesses. And of course, you have the common childhood illnesses that most of us are vaccinated against, the measles, mumps, rubella, diphtheria, whooping cough, all these type of illnesses. So we educate the parents on the importance of vaccination to help prevent all of these childhood illnesses.
I would like all parents to know if their child has persistent fever, particularly lasting for more than 48 to 72 hours, this should not be taken lightly. Fevers can indicate a more serious disease in a child, for example, infection around the brain, a blood infection, or in some situations, very concerningly, it can be a sign of cancer, particularly leukemia. If the fever persists, they definitely should seek medical attention to address the cause of this fever.
Now, in pediatrics, the common illnesses you'll see would be respiratory illnesses, ear, nose, and throat-related illnesses, acute gastroenteritis. So these are the more common things that we would find. Now, in terms of the respiratory illness, the simple common cold, you have bronchiolitis, you have pneumonias. We also have, of course, the ear, nose, and throat, which I mentioned a few, ear infections, tonsillitis, and so. They are very common in children as well. And of course, acute gastroenteritis, which, as we call it, gastro, right? Which is very seasonal. So we tend to see gastro around the time when there's a lot of rains, and so the water could get contaminated and it causes vomiting and diarrhea.
The gut has millions of bacteria. What we know is that in population centers where you have a high population and the hygiene standard is not adequate, the bacteria is more prevalent. Yes, we still say poor hygiene because you consume the bacteria from dirty hands, dirty food, dirty utensils. It goes into your mouth, you digest the bacteria, it infects and it burrows its way into the stomach lining and causes an ulcer, which can affect your overall ability to digest your food.
Like anywhere else in the world, there are inherently predominant non-communicable diseases, such as the prevalent chronic respiratory condition, asthma. Let's hear more from Dr. Akar Stewart of Jamaica.
The children usually have the chest tightness. They may have audible wheezing. They may be more irritable than usual, the runny nose, that sort of thing, which usually clues you in that there is a viral infection or something. Because especially in the children, they are very exposed to the viruses, and the viruses we know will trigger an asthma attack. In the adult, it's usually they will get the chest tightness and the coughing, the excessive coughing. They may also have the congestion, and the cough may not be productive. But the point is that it starts off viral. For the children, they need to be seen quickly, to be nebulized or to get their puffers with their spacers. They need to be seen. You too need to be seen by a physician so that it doesn't escalate. And what starts off as a simple viral can be complicated by a secondary bacterial infection, where we run into serious problems now and your asthma becomes worse.
Of course, asthma is a chronic respiratory condition, and of course it's a very common thing within our Caribbean setting. Sickle cell disease, again, it's very, very common. So these are two of the illnesses you would see that are not communicable in our Caribbean setting, and in all the islands we've more or less followed the same pattern. Now, the thing about sickle cell disease is there are different types, all right? But what sickle cell disease causes in children, in the early stages, you would see what we call, swelling in the joints. Then you also have them having like the hemolytic crisis, where the hemoglobin or their blood levels drop significantly because they're damaged. And of course, you would require transfusions if they're aware that they have the trait. So everyone should know their status. So in Grenada, everyone gets screened at 1, right? It's done, we do newborn screening, but we screen again at 1 just to make sure that there are no issues. Sickle cell disease is a lifelong problem. So the children, they get painful crisis, all the different crises I spoke of. They get jaundice, that yellowing in the eyes. So you would see children with yellow eyes, and some most likely could be sickle cell disease. But what we do, we educate the family members. It's a family affair. So we educate them. Your child has sickle cell, what do you do to prevent a crisis? Good hydration, keeping free from infections, right? Making sure you're in an area that has good oxygen flow. So if you have sickle cell and it's summertime and you're gonna go to the beach, you better be walking with lots of water and coconut water so that you don't get a crisis.
I cannot go without mentioning the World Pediatric Project. Now, this project, since 2002, this has been started, and St. Vincent and the Grenadines has become the surgical hub for this organization. It's a team of medical doctors voluntarily giving their service in the Eastern Caribbean region. So St. Vincent being the surgical hub means that we do have, when they have specific missions, we do have patients that are being transferred here for their operation, and sometimes they come for their follow-ups. They're children who before did not have hope of even living to see a certain amount of years. And these children are growing up to be adults. Something that should be simple but is not available to us used to hinder them from having that opportunity. So with the World Pediatric Project, it's about giving hope to our children. So if there's a mother, for example, with a Down syndrome child who has a heart defect, for example, and this heart defect is going to deem the child not passing a certain age. Now, they have the referrals, we can refer to WPP, and if it's urgent, if it's an emergency, we actually can have contact with them, telling them how urgent it is, and they would respond accordingly.
Thank you, Dr. Walters, for enlightening us about these life-changing ventures and opportunities. Stay tuned to Caribbean Medical TV. We'll be right back with more.
Social investment has always been an integral part of the Republic Group's DNA. We firmly believe that we have a role to play in supporting and uniting many across boundaries of space and culture in the pursuit of building stronger, more sustainable societies. By forging alliances with NGOs and championing meaningful outreach initiatives, we continue to make an enduring, positive impact on the people and communities we serve. The Power to Make a Difference program is an extension of the bank's commitment to do good by doing better. Doing good by pledging our support to noble causes, and doing better in the service of others.
You know, caring for your child's health is a multifaceted venture. There is the body, but also the mind. It is all connected. Let's hear from pediatric neurologist Dr. Mishka Duncan-Adams of St. Vincent and the Grenadines.
Pediatric neurology is a subspecialty of pediatrics. It's a field that focuses on many aspects of neurological care. Epilepsy, and that's another name for that, would be seizures. We see quite a bit of persons with that. We focus on the care of headaches. We focus on persons who may have muscular and neurological disorders with the nerves, brain, spine. And we also focus on developmental disorders of children specifically. Children learn, especially young children, through play. It's actually very important that children play. And a lot of times, as parents, we may see this play as being intrusive into our lives. They scatter things, they break things, they run up and down, they can injure themselves. And as adults, we are responsible for making sure that they do not. But play is a very vital part. Feeling things, touching things, interacting with people. We are in the era of technology, and it's very convenient to pull out a cell phone to look at different programs. And a lot of times as parents, we think this may be beneficial to the child because they are learning programs that these children are seeing. And even though technology has its role in child development, it has been found that the early use of technology for children, for babies, in that stage where they are developing and they need to learn social interactions, can actually be detrimental to the child. What happens with the technology is this: you learn things, yes, but the device is not a person. The device does not respond to you. The device does not stimulate you to have a conversation. And so, as convenient as it is actually not recommended, especially in children under 2 years old and in children in development. And on research, we have found that there's actually an entity that is emerging that is known as virtual autism, which is precisely as a result of a lack of socializing and early use of electronic devices in a developing brain. So as I would like to mention, technology is good, it's useful, but it has its drawbacks. And I like to think that with the change of the world, whenever there's something new, there's also a pathology that is associated with it. And in this case, when it comes to technology, there is that association when it comes to it with speech delays and autism. So knowing about it, knowing how to deal with it, getting on the same level of your child and playing with your child is what is considered very important. What is important is that they're in an environment, a daily environment that is conducive to their learning. I've seen children that they never set foot in a preschool or a daycare, but they had parents that were there, that were nurturing their development, that would sit and play and talk and bring out the books.
So we've definitely seen the linkage. Now, it's very important that patients' mental health be considered as part of their whole being, the whole wellness package that we're trying to achieve. In my questionnaire for when patients come in, there's a question about how do you sleep? And right after that is, are you stressed? Yes. And I usually see the expression on the parents' face when I ask the kids this question. And it's like, you know, they don't have any stress. But surprisingly, sometimes when the kids answer, they're stressed and worried about some condition the parent has. And the parent is not even aware that the child knows of this. Sometimes you see manifestations, especially things like bedwetting and so, or behavioral changes in the children. And when you question them, it's oftentimes related to stressors, either at school or at home, or worry about a kid or loved one, a parent, a grandparent, and illness.
Communication is key. This skill serves as a stimulus for growth, not just for the child, but the family unit and larger community.
Just like adults can go through depression and anxiety, children also go through things like that. And it may not be the same symptoms that adults come to you with. So children may drop back in school, right? They may just not play as much, good. They may lash out at maybe their friends or their siblings, good. They may say things that you're not accustomed to hearing them say. And it's not that that child is bad. So I know as Caribbean parents, I know there's this culture of beating, but sometimes we need to take a step back and we need to try and figure out, why has my child dropped back in school? Well, why isn't this child paying attention to the teacher? Why is she lashing out at her sister, right? So all of these things we need to take into consideration.
As it relates to mental illness lower down the road, there's a need for families, beginning with parents or the seniors in the home, to exercise some measure of self-control, because the verbal abuse is terrible. It has blown up in our faces because we're not able to speak to our children in a manner that is humane, a manner that reflects respect, a manner that would reflect the Christ in us as believers. However, there's a spill-off because the children will speak to the teachers in the classroom in that manner. They speak to other adults, and at some point, they begin to speak to their parents in the same way.
With the advent of social media and the vastness of the digital space, we have witnessed a new phenomenon emerge. Worldwide, there's been an increase in bullying, body dysmorphia, and other social issues amongst our youth. For even technology can have side effects that impact one's health.
I would like to put parents on guard that in this age of technology, we need to pay keen attention to what our children are doing when they're on their phones, when they're on their tablets and on their computers, because they're exposed to so much via the internet. And you need to be the gatekeepers who will basically decide what is good and safe for your child or your children to look at, right? You don't want them to fall prey to any sort of bad influence on the internet.
It comes back to that external validation, that need to be heard, to be seen, to be felt, to be liked, to be loved, because maybe that's missing from our lives. Or the source of all that, we are not okay with ourselves. We are not comfortable with ourselves. We don't fully love and accept ourselves for who we are. So we need it from someone else to feel as though we're good enough, because we don't think we're good enough for ourselves. So that's why we're on social media. We want the likes, we want the comments. And so you pose in a certain way, they teach you how to do these things. If you go on TikTok now, there are all these tips, pose like this, do this, don't do this, this is for perfect, this is for this. And I'm like, okay, yes, it gives you a more, perfect or that illusion that you're looking for, but it's not the reality of what is. And then when you get sucked into this illusion is what I would like to look like, then you keep doing it over and over and over. And at some point in time, you lose touch of who you really are.
There have been a lot of fighting, a lot of bullying, a lot of just not being able to manage the stresses of everyday school. It has definitely been a challenge for kids, and it is important for their parents to understand this. Understand that your children, though they may not have to pay bills, though they may not have to worry about what's going on in the household, children have stressors. Children have anxiety, and they do get sad, they do get depressed, they do experience all of the things that you as an adult will go through, sometimes more.
You need to look at what happens at home. The way parents are talking to each other, the way the family members are interacting, the way parents talk to their children, and whether or not the parents ever, more or less teach their children, you do not do this, this is not right, And what I would like to say with that is just that when you're talking to your child, never impose, but make them think, So like if your child does something wrong, instead of beating them, screaming, shouting, yelling, you don't do this, stop and say, okay, look, this was not right. Let's talk about why.
So that brings us to the point of the physical violence, yes, and the physical abuse. And we see it filters in our children because they inculcate it. Sometimes children have to take sides. And then sometimes children will have to be taken away from the house. Children run away from the house. And because that bond isn't there, they look for love, they look for attention elsewhere. And sometimes where they get it is not what they really need. But they embrace it because it appears much better than what is in their individual homes.
And it's not just the home, it's the community that you live in, it's what you see surrounding you. Do teachers do anything about this in school? Yes, education starts from home, but at school you can also do, right? I feel like we don't do enough in schools to teach children simple things like manners or how to be kind, teach them mental health things from little so they learn. But instead of suspending them and sending them home to do nothing, where, maybe at home they're in a toxic environment or something else is going on, you send them during that space of being suspended to a counselor or to a therapist. If we can help them be better persons, then they can now have a different role.
So I would like all parents, including caregivers, to understand that every child is different, every child is unique, and every child has different needs and wants. I would like every parent and caregiver to acknowledge this and approach a child very uniquely and address their psychological in addition to their medical needs. I think if this is addressed, every child will be managed appropriately. As the saying goes, it takes a village or community to raise a child.
Thank you for joining us on today's episode. I think we can agree, some of our most gratifying moments in life are rooted in seeing children achieve their fullest potential. Nurturing our children is key, for they are our future. Join us next time for another compelling episode of Caribbean Medical TV.